In 2017, Italian researchers Sabrina Rossi and Alessio Petidis published what is called a cohort study. Rather than collect data directly, they reviewed the findings already assembled and reported by others. The authors carried out an in-depth review of all the multiple chemical sensitivity research done in the past 17 years, looking for new diagnostic and epidemiological evidence. As part of their analysis, the professors noted that the symptoms manifested suggest a framework where the severity increases progressively through 4 stages, getting worse at each stage. Stage 0 is designated as tolerance. Not everyone can develop chemical hypersensitivity. First, you must have the genes which code for the switch that activates the condition. This stage represents those who have the switch, but it hasn't been flipped yet. Either a significant one-time exposure incident or ongoing exposure to smaller quantities of toxic chemicals can activate the condition. Stage 1, sensitization, represents those sensitives who have had their switch activated. Once the switch is flipped, nobody knows how to turn it back off. There is no going back to stage 0. The only known effective treatment is total avoidance of any chemical that causes symptoms. These patients commonly relate adverse skin, eye, and breathing conditions. Itching, tiredness, headaches, muscle and joint pain are all frequently reported. Other commonly noted symptoms are nausea, changes in heart rate or blood pressure, balance problems, flu-like symptoms of cold or fever, difficulty thinking or concentrating, asthma, immune disorders, and other seemingly unrelated conditions. Ongoing exposure to triggering chemicals will cause the patient to advance to stage 2, inflammation. Each and every exposure is believed to have a cumulative effect, helping to advance the progression. The symptoms experienced in the previous stage continue to get worse and spread into other organ systems. According to the study, dermatitis, vasculitis, immune, endocrine, and metabolic diseases are common. Patients in this stage report increased sensitivity to environmental allergens like dust or pollen. Arthritis, colitis, rhinitis, dyspnea, which means difficult or labored breathing, asthma, muscle fatigue, fainting, cognitive delays, poor peripheral circulation, even unexplained bleeding are documented. In stage 2, patients are often misdiagnosed with allergies, fibromyalgia, chronic fatigue syndrome, or other more accepted conditions which present overlapping symptoms. As expressed in the report, given the diagnostic difficulty in the early stages, it is possible that neither the doctors nor the patients find the causal link between the symptoms reported and the exposures. By strictly avoiding triggers, patients can achieve a form of remission back to stage 1. While not actively symptomatic, even the smallest exposure can bump the patient back up into stage 2 or higher at any time. One of the things the researchers explicitly point out is that after an exposure, symptoms may persist and oscillate for days, if not weeks. When the patient is unable to avoid all of their triggers, the cumulative effect of toxins building up in the body produce stage 3, deterioration. In this stage, damage to tissues and organs occurs. The central nervous system, kidneys, liver, lungs, immune system, blood vessels, and skin are frequently compromised. Symptoms are severe and present as lupus, ischemia, heart failure, even cancer. Autoimmune, neurodegenerative, and psychiatric syndromes are the most common diseases in this stage. Again, strict avoidance can moderate the severity of symptoms to a lower rung of the ladder. However, as the professors acknowledge, given that most of the chemicals implicated are common environmental pollutants, it is practically impossible to avoid them completely. Because of this, individuals who have the disease will be, depending on the stage reached, more vulnerable than the general population. For more help, visit us online at mcshelp.org. Thanks for watching.